Hi, welcome to this Lunch and Learn for Pediatricians, Stuttering in Children, and When to Refer to a Speech-Language Pathologist. Stuttering, an introduction. Stuttering is found in all parts of the world. It is indiscriminate to occupation, intelligence, income, gender, and age. Currently, over 3 million Americans stutter, and the cause of stuttering is still unknown. The average age of onset is 2.8 years old. ASHA defines stuttering as a fluency disorder characterized by rapid or irregular speaking rate, excessive disfluencies, and often with language, phonological, attention deficit, and motor problems. Blocks, repetitions, and prolongations are commonly used terms to describe stuttering behaviors. And why is this important to know? The physician is often the first professional to whom a parent turns for help. Knowing the difference between normal developmental speech disfluency and potentially chronic stuttering enables the physician to advise parents and refer when appropriate. Early intervention for stuttering can be a major factor in preventing a lifelong problem. Here is an example of prolongations, repetitions, and blocks. Risk factors for stuttering include a family history, gender, age, duration of onset, duration of stuttering moments, continued presence of prolongations and blocks, and phonological skill development.
Since normal childhood disfluencies are hard to distinguish from early stuttering, it is crucial to ask parents questions about their kids' speech in order to make a referral decision.
Here is a list of 10 simple questions to ask the caretaker concerning your patient's fluency. This will help in the process of distinguishing between normal disfluency and stuttering.
Normal disfluencies often increase when the child is tired or excited, or when he is asked direct questions. The child is unaware of her own disfluencies and her speech fluency commonly fluctuates. Between 18 months and 3 years, normal disfluencies occur approximately once every 10 sentences. The disfluencies are typically repetitions that are of short duration and occur at the beginning of sentences. After the age of 3, normal disfluencies are more likely to occur on whole words or phrases instead of sounds and syllables. This video gives an example of a child who has normal developmental disfluencies. Mild stuttering typically begins between the ages of 2 and 5 when language is developing rapidly. Children with mild stuttering will repeat sounds, syllables, and words similar to normal disfluencies, but the stuttered moments typically have 4 to 5 repetitions rather than 1 to 2. Children with mild stuttering may demonstrate prolongations. They will also show an awareness of their stuttering by looking away or blinking. Children with severe stuttering show signs of physical struggle such as facial grimaces and high vocal pitch during moments of stuttering. Children with severe stuttering have excessive disfluencies which occur in every phrase or sentence. The duration of each stuttered moment usually lasts longer than 1 second. Prolongations, blocks, and interjections are common. Parents show marked concern about their child's communication.
So now that we know the risk factors of stuttering and the types of stuttering, let's review. So how do you know if your patient is at risk? If your patient is male, that puts him at a higher risk. Has your patient stuttered longer than 6 to 12 months? Did onset occur after age 3.5 years old? Is there family history of stuttering? And does your patient show signs of tension or struggle when speaking? Or is there a history of delayed speech skills? And lastly, did your parent answer yes to any of the questionnaire questions we referenced to previously? So when is the appropriate time to refer to an SLP? We have 3 categories your patient can fall into. If you have determined that the child is demonstrating normal disfluency, it is okay to not refer. But if the caretaker is concerned, I would highly suggest going ahead and providing the caretaker with a list of tips and monitor. If the caretaker is moderately to overtly concerned, it is okay to go ahead and make the referral. Now, if you believe that your patient falls into the mild stuttering category, you can provide the caretaker with the same list of tips to work on at home and make a follow-up appointment to see if the stutter has continued after 6 to 8 weeks. If the stutter has in fact continued or progressed, refer to an SLP at that time. And lastly, if you believe your patient shows signs of a severe stutter, refer immediately. Here's an easy cheat sheet to keep handy while working with a patient showing signs or symptoms of disfluency. This is a good reminder of the differences between normal disfluency, mild stuttering, and severe stuttering. It's also helpful when questioning the appropriate referral decision. And lastly, here's a copy of the tips you can provide caretakers with. And this concludes the Stuttering with Children, when to refer to a speech-language pathologist, Lunch and Learn. If you have any questions, please feel free to ask questions at this time.